Welcome to this edition of Time with Dr. Mahama. Genesis chapter 1, verse 28, part B. Fill the earth and subdue it. The hazard caused to our health by Galamsey. Another meaning of subdue, according to Webster Dictionary, is to till or cultivate land. It is possible to mine for gold in a way that fits the meaning of subdue or to till or cultivate land, as was God's intention when God said, fill the land and subdue it. In this episode, I'm looking at the risk of or impact of Galamsey on the health of the current generation of Ghanaians and the risks to Ghanaians yet to be born. Let us start by looking at the impact of Galamsey on the miners themselves and on the surrounding communities. On the miners, Galamsey has a severe multifaceted health impacts on the miners themselves, largely driven by the use of toxic chemicals like mercury and cyanide. Because these miners are not aware of the dangers posed by these chemicals and how to handle them, they suffer the far-reaching consequences of heavy metal poisoning, chronic diseases, and developmental issues in their children. Some young men from the north of Ghana who came south and engaged in Galamsey have returned to the north of Ghana with little money, but coughing blood and other Galamsey-related chronic respiratory diseases. Mercury and heavy metal poisoning. The use of mercury to amalgamate gold results in severe contamination of water bodies, soil, and air. Mercury exposure causes neurological damage, tremors, memory loss, and kidney dysfunction. No wonder our dialysis centers in Ghana are overwhelmed. Mercury levels in some areas are 134 times higher than the safety thresholds. Future generations. Birth defects and reproductive issues. Exposure to pollutants, including mercury, lead, and arsenic, is linked to an increase in congenital malformations, birth defects, and low birth weight. It is also associated with higher rates of miscarriages, that's abortion, stillbirths, and infertility, affecting both male and female reproductive health. Respiratory illnesses. Inhalation of dust, soot, and toxic fumes from mining activities and machinery causes chronic coughs, bronchitis, and respiratory diseases, waterborne and infectious diseases. The destruction of water bodies and poor sanitation in mining communities lead to outbreaks of gastrointestinal diseases, diarrhea, cholera, and typhoid. Open pits left by miners create breeding grounds for mosquitoes, causing a surge in malaria cases. Cancer risk. High levels of arsenic in water and food stemming from tailings are linked to an increased risk of bladder, lung, and skin cancer. Physical and mental health issues. Miners face immediate dangers from mine shaft collapses, and in many cases turn to substances such as tramadol and marijuana to cope with the harsh conditions. Recently, a shaft collapse is reported to have killed 9 people. These types of deaths are preventable and sadly take lives of young people who die prematurely. Impact on children. The Pediatric Society of Ghana has warned that children exposed to these toxins experience permanent brain damage, reduced IQ, and developmental delays and behavioral issues. Long-term environmental and food risks or food safety risks. Galamsey causes severe, lasting damage to the food chain. Heavy metals, particularly lead, mercury, and arsenic, have been found in high concentrations in cassava and plantain crops grown in affected areas. This results in the ingestion of toxins by local residents, even if they are not directly involved in mining. These foodstuffs may also be sold in areas far away from Galamsey sites. Urgent calls for action. Health experts and organizations have called on the government to treat Galamsey as a national health emergency, urging for stronger enforcement, the protection of water bodies, and the provision of alternative livelihoods to curb the increase. The current generations of Ghanaians will be considered by future generations as morally bankrupt for putting our interests ahead of our own descendants. Everybody knows what is needful. What remains is the political will to do the needful. Thanks for listening. Share with family and friends, and tune in next time.